So Jerry, now that we've calculated your plaque score, we're going to talk about why plaque is so damaging to your teeth. You have an infection right now, a bacterial infection in your gums, and in the bone, and in the structures that are supporting your teeth. And we're here to talk about why plaque is so damaging to your dental health and your oral health, and what you can do about it. And before we leave here, we're going to have you remove 100% of the plaque off of your teeth. So in the mouth, you have basically, most people have about 28 teeth. You have 28 teeth, and the teeth you have two parts. There's the part you chew with that we call a crown, and the second part of the tooth that you don't see that's buried in the gums and the bone is called the root. And ideally, your gums go right to a line on the tooth that separates the crown from the root. That's an ideal situation. However, when you get bacteria in your mouth and you get plaque, which is what we're going to talk about, you can have loss of bone, loss of gums, and loss of the supporting structure that holds the tooth in the bone. The teeth can get loose and eventually even fall out. And that's what periodontal disease does, and that's why plaque is so dangerous. Within about a few hours of eating carbohydrates, the bacteria that are in everybody's mouth, it doesn't matter how clean you are, how much you brush or floss, you have bacteria. The bacteria in your mouth break down the sugars in your food, and that's any kind of sugar. It could be table sugar, it could be high fructose corn syrup, it could be starch in a potato or even in bread. The bacteria break that down, and they basically make two very important products, byproducts. Number one, they make acid, which you've already talked about, and that's what causes tooth decay. And number two, they make this sticky, almost glue-like material that is plaque. So plaque is a combination of bacteria and this sticky substance that helps them stick to the teeth. And if you see here on these teeth, you can see along the gums, there's this white, cheesy film of plaque. And so plaque is a mixture of this sticky substance and the actual bacteria. And that's what causes gum disease, and actually that's also what causes tooth decay, is the acid that these bacteria produce. So whenever you have plaque on your teeth, if that plaque is not removed within about 24 hours, the plaque and bacteria actually become mineralized. So you can see here in this picture, this patient let a day pass without brushing or flossing. They failed to brush their teeth, they failed to floss, and within about 24 hours, the plaque became hardened and turns into what we call calculus. So a normal, healthy person produces saliva when you eat, and saliva is fantastic. It gets rid of the acid the bacteria create that causes tooth decay, and the plaque, or the saliva rather, can help digest your food and also help clean your mouth. One of the pitfalls of plaque is the minerals that are in natural saliva. If you don't remove the plaque, they can actually go into the plaque, harden the plaque, and the plaque becomes mineralized and hard. And so instead of being soft and cheesy that can be removed with a brush, the plaque becomes hard and really crystalline, which basically means that you can't remove it with floss. So you see here this patient had this white cheesy plaque that turned hard and brown and into calculus. And once you have calculus on your teeth, there's nothing you can do to remove it. You can brush and brush and floss, and no amount of brushing, no amount of flossing will remove this calculus off your teeth. So calculus does not cause gum disease. The infection that you currently have is not caused by calculus, it's caused by the bacterial plaque. However, calculus provides a hiding place for the bacteria to hide from your body, from your immune system, and also to hide from your brushing and flossing. So what happens ultimately in periodontal disease is you have a loss of gum tissue, you have a loss of bone, and you have a loss of a special ligament that holds the roots of the teeth into the bone. So this patient, you can see, has suffered from advanced periodontal disease. And if you look at the word periodontal, peri means around, odontal means tooth, and so periodontal disease is the disease of the structures around the tooth. And how it works is whenever you have plaque on your teeth, especially next to the gum line, your body recognizes you have a foreign bacterial invasion. You have a current active infection going on in your gums and going on next to your teeth. And so your body sends special cells, special immune cells, to the site where the bacterial plaque is, and your body tries to destroy the plaque and tries to destroy the bacteria and get rid of this infection. There's a battle going on between your immune system and the bacteria, and who really loses is the periodontium around your teeth, the supporting structures of your teeth. So your body, in trying to kill the bacteria, destroys your own bone, destroys your own gums, and destroys the special fibers that hold your gums onto your tooth and also holds the bone onto the tooth.
Now you said I couldn't remove the calculus, but how do I get the calculus off my teeth?
My role as your dentist or even as your hygienist is to remove all of the calculus in your mouth at least on a 6-month basis, and sometimes even more often. Sometimes for patients who have more advanced periodontal disease, we'll have them come in more often. And if I can remove all the calculus off your teeth at a minimum every 6 months, and you remove all the plaque off your teeth every 24 hours, there's no reason why the average person can't maintain their teeth and keep their teeth in a healthy situation. So Jerry, this picture shows us a good example of a healthy situation. This patient has not had periodontal disease or gum disease, and what we're going to do is look at sort of the normal structures that should exist in the mouth. So you can see here we have some teeth, and down here this wispy brown area is bone. And in between, these are the roots, of course, and the crown, and the roots and the crown are separated by the gums. A thread-like stringy attachment we call a ligament. In fact, it's called the periodontal ligament. And what happens is your teeth are embedded in the bone, and they're actually glued into the bone via this stringy attachment. You see the bone level goes up right about to the junction where the crown and the root meet. And the gums also go at that level. And in a healthy situation, you have a little bit of an overlap between the gums and the top of the tooth, the crown of the tooth. Patients will have about a 2 to 3 millimeter crevice around every tooth where the gums will actually come up and overlay the top of the tooth. And in quite a few of your teeth you had 2 to 3 millimeters, but unfortunately you had some situations where this crevice was actually deeper. And when you have a deeper crevice than 2 to 3 millimeters, we call it a pocket, a periodontal pocket. And pockets are bad for a number of reasons, and we'll talk about why. This picture describes what it is that I was just talking about. So every 6 months at a minimum, we like to go around the teeth and make sure that the gums and the bone level and this attachment, this periodontal ligament and these fibers are at a nice healthy level. So ideally, when we put this instrument in this crevice around the teeth between the gums and the tooth, we see there's a 2 to 3 millimeter space. So there's a 2 to 3 millimeter overlap of the gums on the tooth. However, as periodontal disease sets in, when there's plaque chronically on the teeth and bacteria, you get a situation where you go from 2 to 3 millimeters, where this instrument's going in, to now maybe 4 to 5 millimeters. And what that tells us is the bone is dropping, the periodontal ligament that holds the teeth into the bone and holds the gums against the tooth is dropping, and the gums are dropping. And you see here this patient has had plaque and calculus. You can see the plaque and calculus on this page. They've had that for probably many, many months and many, many years. And had they cleaned this plaque out of their teeth, and had they cleaned the calculus out of their teeth, it's likely that the bone level, this ligament, this stringy attachment, and the gums would still be up here where they need to be. But unfortunately, this patient has lost their bone, they've lost this ligament that holds the teeth into the bone, and they've lost gum structure. And that's the result of periodontal disease. The body senses this plaque, it senses the plaque and bacteria in the calculus, tries to destroy the plaque and destroy that bacteria, and ends up destroying itself. Your own immune system ends up destroying the bone and this ligament and gums. And the result is teeth that get looser and looser, gums that drop more and more, and eventually the teeth can get so loose and so weak that you bite into food and your tooth can come out with the food. And eventually it gets to a case where if this plaque and bacteria is not stopped and removed, and if some procedures aren't done to take care of this bone loss and the loss of the gums, eventually it can get so bad that you actually lose your teeth. And this is completely different than tooth decay. You can have 28 pristine teeth in your mouth with no decay whatsoever, and still they can be incredibly infected in the bone and gums, and you can lose your teeth. Even with no cavities, you can lose all your teeth. Most people aren't aware of that. They think that the only way you lose a tooth is through cavities, but that's not actually true. A lot of people that don't take care of their teeth and have cleanings regularly by a hygienist or dentist can lose their teeth because of periodontal disease. So this situation shows a later stage of bone loss. So for many, many years, this patient wasn't brushing, they weren't flossing, they weren't following up with a dentist or hygienist, and as a result, the bone level, whereas it used to be up here between the separation in the top of the tooth, the crown, and the root, the bone level is now way down here at the tip of the root. And you can see this ligament that holds the tooth into the bone. It used to be way up here next to the top of the tooth. Now it's dropped all the way down here. And this patient has probably a 5 to 6 millimeter pocket. And a pocket that deep is incredibly dangerous to the health of your teeth. And the reason a deep pocket is so bad is you can't get your brush down there. It's very difficult to get floss down there. And so it's just a breeding ground for bacteria. However, when you get periodontal disease, when you start getting bone loss and this ligament being lost and your gums receding, you get bacteria way down here deep in your gums, and they don't actually need carbohydrates to live. So it's critical, no matter how good your hygiene, no matter how good your home care is, it's critical you come at least every 6 months for a cleaning to have all of that, what we call subgingival or below the gums, all that plaque removed by your dentist or hygienist. This patient, you can see, this is a good example of really hopeless periodontal disease. This patient for many, many years had plaque and bacteria accumulating on the root, and you can see here all this brown and black area, that's calculus. And whereas the bone, this bone used to be way up here next to the crown, and there used to be a ligament connecting the bone to the tooth. You can see here, this is all soft tissue. This is all infected, festering, bacterial infected tissue here. And this tooth at this point is hopeless. There's really nothing as a dental professional we can do to save this tooth at this point. And if this patient only would have removed their plaque years and years before by effective brushing and flossing, if only they would have come for professional cleanings by their hygienist or dentist, this tooth didn't have to have this loss. So what can we do to get rid of all this periodontal disease? What can we do to get rid of the infection going on in your mouth? There's two things that we're going to be doing at home. What we're going to do, number one, is every single day, once a day minimally, you're going to be using dental floss to remove the plaque off your teeth. And then the technique we're going to talk about is going to be C-shaped flossing. And we're going to make sure when you leave today, you have the best technique possible for your teeth. The second thing you're going to do besides flossing once a day is going to be brushing, and you're going to brush twice a day. And studies show that if you can brush twice a day effectively and floss once a day effectively, you should be able to get your plaque score and the infection in your mouth under control. So what did we do today? Today, just a few minutes ago, we sat in the chair and I painted this special stain on your teeth we call disclosing solution. It's a special stain designed to only stick to the plaque on your teeth. I then counted 3 surfaces on the front of your teeth and 3 surfaces on the back of your teeth. And I determined what percentage of all 6 of those surfaces per tooth is covered in plaque. So your plaque score today, do you remember what it was?
It was 50-something.
55%, yeah. And what did we talk about was the key? What's the key number we want to be underneath?
20?
20%, exactly. So right now, if you looked in your mouth, you'd see pink on 55% of all of your tooth structure. And although that's not as bad as some of the patients I've seen, it's definitely not good either. And in order to get in a good healthy range where you're doing a good job with your brushing and flossing, you should be below 20% consistently. And today before you leave, I'm going to have you remove 100% of the plaque off all your teeth. So when you go home tonight, you can do the same thing, and tomorrow morning you can do the same thing, and for the next 6 months, you can be doing this every single time before I see you next time for our next checkup. So after I have you remove all the plaque off your teeth, I'm going to go through with my special instruments and detect the calculus, that mineralized plaque, and I'm going to use special instruments to remove this mineralized plaque, the calculus. After I have all the calculus off your teeth, and after you can get all the plaque off your teeth, there's no reason why you can't have a healthy situation. And if for any pockets that remain after that process, we can talk about later potentially referring you to a periodontist for more therapy and treatment. So Jerry, let's go ahead and switch places, and I'm going to have you actually take a look in the mirror and look at the plaque you have. I'll swap stools with you here. So if you look here on the model, most of the plaque you had was on the cheek surface of these back teeth here, on the upper and on the lower. You had quite a bit of plaque between your front lower teeth, what we call interproximally, and you had plaque also on the left side, on the cheek side of these outer teeth. So what I'm going to recommend to you as far as brushing goes is what's called the Bass technique. Now the Bass technique is one that's very common and popular, and the reason it's so common and popular is because it's effective. So what we're going to do is we'll start on the upper left, and in the upper left what we're going to do is take the brush, hold it perpendicular to the teeth, and once it's perpendicular to the teeth, we'll rotate it at a 45-degree angle up toward the gums. So some of the bristles will be on the teeth, some of the bristles will be on the gums, and with small circular strokes, you're going to brush 2 teeth for about 10 seconds at a time. And again, 45 degrees toward the gums, some of the bristles on the gums, some on the teeth, 10 seconds. Pick the brush up, go forward. Now again, the plaque that's going to be so detrimental to your gum health, and that's causing the bleeding you're having and the infection you have, is right along the gums. So again, you always want to remember, you want the bristles 45 degrees, some of the bristles on the teeth, some on the gums, and a 45-degree motion with light, easy pressure. So once we do all the cheek surfaces, top and bottom, then we're going to go to the chewing surfaces. So the chewing surfaces of the teeth, instead of going at a 45-degree angle, we're going to be going directly perpendicular to the chewing surface. So I'm going to hold the brush perpendicular to the tooth surface, and I like to go in circular motions. If you want to go back and forth, you can do that. So as you go all the way around, you want to brush 2 teeth at a time, about 10 seconds, small circular strokes. And once you've gone through all these upper teeth and all the lower teeth, then we'll go to the inside surface of the teeth, the palatal or tongue surface. So we're going to go back to the 45-degree brushing. So we're going to hold the brush at a 45-degree toward the gums, some of the bristles on the teeth, some of the gums, 10 seconds for 2 teeth, small circular strokes, nice, easy, light pressure. Now as we get to these front teeth, instead of trying to get the brush in there and get at a 45-degree angle, the curve is a little bit too tight. It's hard to get the brush in there. So what we're going to do is hold the brush as vertical as possible and brushing 1 tooth at a time. We're going to hold the brush straight up and down, and straight up and down motion. We're going to get the back side of that tooth in about 5 seconds. 5, 4, 3, 2, 1. Same thing, all these front teeth about 5 seconds, and I'm going in a straight up and down motion. Usually I'll tell you to go in small circular strokes. This is the one time you can take the brush and go straight up and down as you get these back surfaces. So on the lower, on the tongue side, the exact same process. You're going to hold the brush at a 45-degree angle toward the gums, some of the bristles on the teeth, some on the gums, 10 seconds per 2 teeth. Go all the way around until you get to these front teeth. The front teeth, instead of holding the brush vertically this way, you're going to take the brush and angle it and position it downward, and vertically in a straight up and down motion you're going to brush the back surfaces of these front teeth all the way across. Then again, once you get to these premolars, a 45-degree angle, 10 seconds per 2 teeth. And once you've done all the cheek surfaces, all the biting surfaces, all the inside surfaces, then we're done with the brushing. So before I have you do that yourself, we're going to go ahead and go over flossing as well. With flossing, you want to take a piece of floss that's about 18 inches long. This is probably a little bit longer than you need, but probably better a little longer than shorter. I like to wrap around my middle finger. If you don't want to use your pointer finger, that's fine. I find the middle finger is good to get control with my pointer finger and thumb. But what you're going to do with the flossing, if you wouldn't mind holding that, yep, that'd be great. You're going to start on the very, very back surface, and we'll start on this upper left side. You're going to start on the very back surface. And the key you want to remember is you want to, instead of just going around the back surface of the tooth and going up and down, you want to hug the tooth. If you look at these teeth aren't really square, they're more circular. So you want to wrap the floss around the tooth, make a C-shaped motion, and 3 to 4 strokes you want to go straight down, and with the C-shaped motion go up 1, up 2, up 3, up 4. And then you're going to go in the next contact area. Instead of wrapping around this way, I'm going to wrap around the front surface of this back tooth, and I'm going to go up 1, 2, 3, 4. And you notice I'm not pulling out every time. If you pull out every time, it can abrade the floss and it takes a little bit longer. Once you get it between the 2 teeth, you'll go down to where the floss stops. Once it stops, wrap around the tooth and go up again 1, 2, 3, 4. Now on the next surface, you're going to wrap around toward the front, make that C-shaped motion, hug the tooth, and come up 1, 2, 3, 4. And the same process all the way around the top teeth and the lower teeth. Once you've done that, once you finish with the brush, the 45-degree brushing technique, and the C-shaped flossing technique, there's no reason why you should have any plaque left on any of your teeth surfaces. And start where you usually do. Good. And again, you want to angle the toothbrush 45 degrees up toward the gums. So you can start perpendicular, then angle those bristles up at a 45-degree angle. Yeah, and then small circular strokes. You want to brush 2 teeth at a time for 10 seconds. So go ahead. You can count in your head. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Now you can move forward 2 teeth. And again, nice small circular strokes, 45 degrees toward the gums. Good. Yeah, you want to feel some of the bristles on the gums and some of the bristles on the teeth. Excellent. Yeah, and about 10 seconds for those 2 teeth. As far as pressure goes, some people really like to be aggressive and scrub with the brush. And scrubbing with a lot of pressure is not the best thing for your gums. You can actually lose gum structure and bone if you do that. So all the pressure you need is the pressure you can use with 2 fingers. So if you hold the brush with 2 fingers, that's all the more pressure you need to get the plaque off your teeth. Good. Feel those bristles partially on your tooth and partially on the gums. Good. Now as you get around to this part, you can actually resituate the brush and come from the other angle. Good. You're doing a great job.
I have a hard time reaching my very back tooth. How do I get back there?
Bite your teeth together. Yeah, and then you can really get the brush up there in between your cheek and your teeth. Good. Yeah. Sometimes you can even shift your lower jaw to the right as you bite, yeah, and you can really get the brush up there. Sometimes your lower jaw can impede you in getting that very last tooth, but you should feel the bristles really getting up there along the gums. Excellent. So now if you want to go back up to the upper left, we can do the tongue side of the teeth. Good, what we call the palatal surface. Now, if you remember when we were brushing the typodont teeth, when we got to the front, we stopped doing the 45-degree brushing. And instead of doing the 45-degree brushing technique, we actually turn the brush again straight vertically. So you can start on this corner front tooth, the canine, and get the brush as vertical as possible. Now you're going to brush up and down about 5 seconds per tooth. Great job. You can see the toothbrush is turning purple and pink, getting all that plaque off. Excellent. So now that you've done the front tooth there, now you can go back to the 45-degree brushing. Good. And again, small circular strokes is going to be the key. There's a big temptation to want to scrub back and forth, but that scrubbing motion is not as effective as those small circular light strokes. Good. 2 teeth there, then we're done with the brushing on the upper. And then we can go to the lower and we'll repeat just what we've done on the upper teeth. So you really want to angle the brush down. This is a really common area, these lower front teeth, to have calculus, which is, again, that mineralized plaque. And you have so much saliva down there that if it's not removed, the plaque, it becomes hard and tartar and can contribute more to having the disease in the gums that you've had. So you really want to be diligent in getting that 45-degree angle down there on those front teeth and on these back teeth here. Good. Good job. Yep, 45 degrees. And again, you really want to get it down there, the toothbrush, between the tongue and the teeth. Good. So you're going to start on this left hand lower front tooth and take that brush as vertical as possible. You want to almost touching your nose, straight up and down. Good. Yep. And you can go sort of in a back and forth motion, about 5 seconds per tooth. Great job. And the more vertical you can get that brush, the better it's going to clean those back surfaces of those teeth. You go back to the 45-degree motion. If you can keep this up twice a day at home, every day in the morning, probably after you eat breakfast and before you go to work, and in the evening before you go to bed, there's no reason why you can't get the bleeding that you've had and the inflammation and the infection in your gums under control. You had quite a bit of bleeding when we were doing your probing depths of your gums and pockets, and that bleeding should clear up within about a week if you can do a great job removing all the plaque off your teeth.
Sometimes I have bad breath, especially in the mornings. And I heard you can brush your tongue. Is that something that I should be doing too?
So go ahead, yeah, take the brush, and in a sort of a sweeping motion, you can sweep the tongue and brush it every single day, absolutely. So you're going to be brushing at a minimum twice a day, and it would be good in the morning before you go to work to go ahead and brush your tongue. Sometimes you can have some halitosis or some bad breath because of the plaque there. Yeah. So now that we're done brushing, go ahead and pick up the floss. And again, you want to take a piece that's about 16 or 18 inches rather, about 1.5 feet.
So longer?
That's probably about right.
Okay.
Yeah, most people take a piece that's too short. You don't have the control and all that you need with a longer piece. So fantastic. So the thing you're going to focus on is you go ahead and floss. Start on the very, very, very back surface. You want to think about hugging the tooth or making a C-shaped motion around the tooth. So you want to wrap the floss all the way around. Teeth are circular. So you're going to wrap the floss around the tooth, hug the tooth with that C-shaped motion, and then 3 to 4 times you're going to go down to push the floss all the way to where the gums are next to the tooth. Pull down to the chewing surface of the tooth 3 to 4 times. Yeah, so push your hands way back. 1, 2, 3, 4. Good. Now pull your fingers way forward and hug that tooth in that C shape. Good. 2, 3, 4. Good. And you're doing a great job keeping the floss between the teeth.
I see pink.
Yeah, so if you see some plaque and food debris on there, you can just sort of advance the floss on one finger and take it off the other finger. That's good. So again, you're going around that front tooth, and now you really want to go backwards around the back tooth 3 to 4 times. And some people want to pull the floss out between the teeth every single time, and you're doing a great job of not doing that. It's not necessary. It's more time consuming. So once you get the floss between the contact area, you can just keep it up there. Good. And I just want to point out as you look in the mirror there, Jerry, you're doing a great job wrapping around and getting that C-shaped motion. You really want to wrap all the way around the tooth. Fantastic. So now we'll go to the lower. And you're doing a great job having a routine, starting on the left every time. Sometimes if you go out of sequence and you floss the other side or start with the lower, it's easy to forget a quadrant and to forget some of the teeth. And we don't want to do that as we move forward. So again, you really want to push your hands way to the back of your mouth and pull them forward. Yeah, so you can pull the floss backwards. Good. And now you'll pull it forward, and you'll actually pull it to the right-hand side of your mouth there. Go ahead and turn to your left if you can. Wow, great job.